subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are here on this last Saturday of the month of July, and we have a very important topic that we're going to discuss today, which is silent heart attacks. And we are privileged to have here with us Dr. Rahul Gupta from the Apollo Hospitals in Navi Mumbai. Dr. Rahul Gupta, I will introduce him a bit before I welcome him here. He is a senior interventional cardiologist, a rhythm disorder and valve expert, which is TAVI at the Apollo Hospitals in Navi Mumbai. Dr. Gupta has nearly 2 decades of experience in the field. He has done his MBBS from Nagpur, his MD in general medicine from the University of Mumbai, and his DM in cardiology from the Topiwala National Medical College, which is TNMC in Mumbai. Some of his professional services he's accomplished are coronary artery bypass grafting, stress echocardiography, vascular surgery, aortic aneurysm surgery, and heart valve replacement. Dr. Gupta has been honored to receive prestigious awards through his career, like the Shankar Dayal Sharma Gold Medal, representing KEM Hospital in Mumbai, the Sri Sahil Bhai Ali Wali Gold Medal for scoring highest percentage of marks in pharmacology, and a Young Scholar Award for zonal round first winner. He has been with, as I mentioned, he is a consultant at Apollo Hospitals in Navi Mumbai, and he has worked with various hospitals like the Fortis Hospital, the Hinduja, Hirandani Pawai, and he has been at the Bankers Institute, which is a tertiary care high volume center in Baroda. He has been, as I mentioned earlier, at the KEM and GS Medical College and at the Nair Hospital in the past. And he's going to be talking to us about silent heart attacks. Welcome to Health Live at Seniors Today, Dr. Gupta. How are you?
I'm good, and thank you for the kind introduction. Good evening, everyone who has joined. And whenever
Doctor, first of all, my apologies to you. I know we've got doctor at an operation theater. He's just got out of the operation, which is why I mentioned that we had to start the room early so that we could let him in. Sometimes these technology glitches happen. I hope the patient is doing well.
Yeah, patient is doing well. Patient is doing well. My colleagues, we work as a team. But during the crucial periods, we all discuss. So we are discussing. I was inside the room, but they are taking care. Patient is fine.
That's so good to know. Doctor, we are requesting you to speak about silent heart attacks today. And there's a fair amount of interest in this. Of course, the topic itself is a little intriguing as to what it means. And there's also a fear element which is there. But could I have had a silent heart attack in the past or not, etc. So we're all looking forward to your presentation. Those of you who are here, please watch, listen in to the presentation. And if you have any questions, as always, mention it in the Q&A tab with your age and your gender. And after the presentation is over, I will post it to Dr. Gupta, and he will address it then, the questions.
Yeah, so good evening, everyone. And I'm sorry, I just finished and I could not, we are all in caps and all those things. So my hairs look very untidy, but it was time, so I had to just join in. I think there is a major epidemic which is already happening. We all know heart disease has become very common, and we keep seeing so many people coming with heart attacks. The most devastating, or you can say the most dangerous trends which we are seeing is people coming in their 20s with heart attacks. So heart attack, we all know, is common. It is #1 killer worldwide. But today we are going to focus on understand what is silent heart attack, what are the mimics of silent heart attacks which look like heart attack, how can we investigate ourselves, how can we prevent ourselves from getting a silent heart attack also. So we will delve into, in next 15 minutes, I will just complete the presentation so that we have ample opportunity to discuss things. So I'll introduce what is silent heart attack. I will try to make you understand how the heart works. Then we look at the risk factors for heart disease, symptoms of typical heart attacks. Silent heart attack won't have typical symptoms, but what typical heart attack, that also we need to understand. We will discuss about preventive measures. Whatever age you are, this presentation is going to be helpful for any age, because now gone are the days where I remember when I was doing my training, and somebody who would at 30 come with chest pain, I would call the casualty medical officers, just send them away, give a painkiller. But now we can't do that. We have to, go into the details, see whether this is not a heart attack or whether it's a heart attack, so that we can give the correct diagnosis and treatment. So what is silent heart attack? Silent heart attack is a heart attack that has few, if any, symptoms, or has symptoms not recognized as heart attack. So, when somebody comes to the OPD with acidity, gas, someday they had some discomfort which went off, and during routine evaluation, we find that their ECG is showing abnormality as if they have suffered a heart attack. And when we do a echocardiography, which tells us the heart has become weak, these are the patients who have already suffered a silent heart attack. So we all know that typical heart attack presents with chest discomfort, sweating, breathlessness, choking in the throat, pain in the jaw. But silent heart attack would present with very symptoms which can mimic anything else. Like there could be some mild discomfort in the back, some acidity, or maybe little fatigue, tiredness, which gets better and you don't notice that anything major has happened, and you continue with your work, although with reduced effectiveness. So this is how a silent heart attack would get manifest, where we will actually not know. And sometimes when patients come to me on routine checkup when the heart is weak, they are really surprised that what happened, why the heart has become weaker. Then we investigate and I ask them a typical question, whether you had some discomfort, uneasiness, which you considered as an acidity or gas. And they say, yes, we had those symptoms. And we thought it is acidity and gas. Then it became better. Then I didn't do anything. Off late, I'm feeling a little more tired or fatigued. Or I did this test and I found out that, I have the heart has become weaker. Now, as I told you, it is different than a normal attack because there may not be typical chest pain, shortness of breath, which are typically associated with a heart attack. And it can therefore get underdiagnosed. People who have silent heart attack might think they have had heartburn, flu, strained chest muscles. They would complain of maybe they picked up some heavy thing while going for a shopping. So we will start attributing it to something which we did it recently, and we would say it's not troubling us too much. There's some discomfort which goes away also. But a silent heart attack, like any heart attack, involves blockages of the blood flow to the heart and possible damage to the heart muscle. So everything is same like a typical heart attack, only the manifestations are little mild, and the symptoms are little atypical. They are not a typical symptoms of chest discomfort as we know. So the idea of telling you this is that if anybody experiences any symptom which looks very atypical, which you have not experienced any time before, I think it is important that we go and seek some medical attention, just do an ECG. You will be surprised, a lot of things get picked up. I remember my uncle, this is about 5 years back. He himself is a doctor. He was having some very discomfort and he attributed it to maybe he had eaten something outside the other day in the dinner, and therefore he was discomfort, and he was going to his clinic, and in the clinic he said, let me take an ECG. Also somebody suggested that you take an ECG, and it shows a major heart attack ongoing. So some people, they don't get the symptoms of a typical heart attack, even though the damage might be happening, which is severe. So let us first understand about the heart, how the heart functions, how do the blockages appear, what happens. So heart is a vital muscular organ in the body that pumps nutrients and oxygen-rich blood to the entire body. So it's like a pump, and it beats approximately 70 times a minute, pumping nearly 5 liters of blood per minute, which is quite huge. And life can end for an individual if heart fails to function even for a few minutes. So heart is an important organ. We call it as the engine of, it's like just like the engine of the car. So it is the engine of the body. It is continuously supplying the energy to the entire body, and therefore it is very important. So it is one muscle which never rests. It is one pump which never rests, because when you sleep, your the leg muscles, your chest muscles, all other muscles are resting, but this will never rest. Even the brain can rest, but heart can never rest because it has to supply. Now, heart itself needs blood supply for itself. So if you can look at the chart, this diagram, these roads, these tree-like branches, these are basically the supply to the heart muscles. These are called as coronary arteries. And these are the ones which are supplying the blood to the heart muscles, because heart has to continuously work. Now, if these muscles, these arteries, if they develop any kind of obstruction, which are called as blockages, the supply to the heart muscles starts getting hampered. And if the blockages start becoming severe, the blood supply starts reducing and the damage might start happening in those areas might become weak. So usually when the arteries become very narrow and the blood supply is reduced, the initial symptoms are they start experiencing discomfort on walking, climbing stairs, because those times the heart is pumping harder, it needs more blood for itself, and these blockages do not allow that blood supply to go forward, and therefore these symptoms start appearing. Now, in a silent heart attack, there might be a blockage which is very severe, but the symptoms are not very classical. Now, if you must have heard about something called a disease called as leprosy, where these pain signals are completely gone, people can get burnt and they will not even realize that they have got burnt. Similarly, especially in diabetics, these pain carrying fibers, the pain of the heart, which is carried by these nerves, they get damaged, and therefore even if they have discomfort, they don't experience the pain or typical symptoms because the nerves have got damaged. This happens more commonly in diabetics, but it can happen sometimes in non-diabetic patients also. So this is a typical heart attack which occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off, as I was telling you. And it is also called as myocardial infarction. And most of the time it is because of the heart attack is because of the plaques or the cholesterol thing which is getting deposited in the arteries, making them narrow. So like you can see on this chart, this is a healthy artery. This is the cut section. We are seeing a longitudinal section as well as we are seeing a cross section, the round one. When the block develops, there is a deposition of the plaque into the layers, because of which there is a narrowing. Now, during a heart attack, there is a rupture which happens. Suppose you get a cut on the hand. What will happen when the cut happens? The blood oozes out from the hand and it forms a clot. Similarly, when the cut happens in the plaque, the blood oozes out, it forms a clot, which can severely impair the blood flow to the heart, resulting in a heart attack. So it can happen with sudden clot formation, or because of the very severe blockages, the heart attack can occur. Now, these are typical. So we have understood that the silent heart attack would not have typical symptoms. But what are the typical symptoms we all should know? Now, the warning symptoms of heart disease could be discomfort in the center or left side of the chest. I will, the heart symptoms can occur from nose to navel. So we say naak se nabhi tak, nose to navel, either in the front or back. It can happen anywhere. It can be discomfort in the jaw, discomfort in the throat, back of the neck, back, chest, and upper part of the abdomen. And this can be confused by different other symptoms. Like you can go to a dentist when you're having a jaw pain. You can end up with the orthopedician if you're having a back pain. You can end up with the gastroenterologist if you're having the upper GI acidity kind of symptoms. And you can end up with the orthopedician if you are getting some arm pain and all those things. Very important part which we all need to understand. If you are feeling any of these symptoms from nose to navel, which comes on activity like walking, climbing stairs, walking a little faster, and which gets better with rest, are symptoms which should not be neglected and which should be considered until proved otherwise as a heart-related symptom. Then shortness of breath can be there, breaking out in cold sweat. Suddenly you are sitting in an AC and you are profusely sweating. There may not be any other symptoms. Now, this is also sometimes there are no other symptom except breaking out in a cold sweat, which you rest, you think probably it was hot, or you give some certain reasons in your mind. You rest for some time, you become better because body has taken a little bit of care, but that damage has occurred and it gets detected only during health checkup when you do an ECG or 2D echo. 2D echo is like the sonography of the heart, which tells us about the function. There could be feeling unusually tired for no reason, sometimes for days. And there could be nausea, feeling sick to the stomach, and vomiting. So these are very atypical symptoms which may have occurred and may have resulted in heart attacks. Now, what happens when somebody has got a heart attack? The most important problem is the heart can start beating in a very abnormal rhythm, very chaotically, which leads to, when it starts beating chaotically, it can, the BP can fall down and eventually the heart can stop, which can lead to sudden cardiac death. And therefore you need to give shock. You must have heard about people giving CPR, chest compression, and sometimes giving shock, because these abnormal rhythms need to be tamed down by giving a shock. It can lead to weakness of heart, which can lead to heart failure. Heart failure means the heart is still working, but it is failing to perform its function normally. And there is water accumulation in the body. A person feels very breathless. If they lie down, they are feeling more breathless. There can be swelling over the feet. And sometimes there can be valve problems, heart rupture, and death in severe cases of heart attack, as we see. So therefore, recognizing early is very important, and the treatment in time is something which can really save us. So when we have a diagnosis or suspicion of heart attack, it's like an emergency. Every second counts, and every second lost can push the patient towards fatal and non-reversible complications of heart disease. So we should rush to the nearest possible center where the cardiac management is available. Now, as I was talking to you, this was how the heart attack can manifest, how a silent heart attack can manifest, and how a major heart attack which will present with manifestation. We should understand that this is a gigantic killer because it is the #1 killer worldwide. India is already world capital of diabetes, blood pressure, and heart disease. And the burden is continuously rising. According to the WHO prediction, the incidence of heart disease is continuously rising in Indian subcontinent, and it was bound to continue to increase unless we all together, like through these awareness sessions, understand that how we can control. So it is very easy. I'm going to go through it, that we can control the heart disease. Now, there are modifiable risk factors and non-modifiable. Now, there are non-modifiable risk factors which we can't do anything about. Like, for example, increasing age. There is a wear and tear which is happening in each one of our body, which we can't modify, but we can retard that, as we will see. Males are more, affected by heart disease as compared to females, especially before menopause. And if there is a strong family history, then there is a more possibility of having a heart disease in the family. But we should not worry too much about it, because the modifiable risk factor which is in our hands to control is something which we should do. So smoking, diabetes, high sugars, high blood pressure, overweight. If you're not active at all, it increases the risk of heart disease. Consuming less fruits and vegetables, excess alcohol, there is a high cholesterol value and lipid imbalance, and too much of stress can also lead to heart disease. And these are something which we all should modify. I think we don't need to emphasize enough that, smoking, we all know it is dangerous. Even passive smoking is dangerous. And there are multiple ways. It increases the bad cholesterol, it increases the blood pressure, free radicals, damages the arteries, and this can lead to early heart attacks. High sugar, again, is a risk factor. But I can tell you, there was a study which was done which showed that those people who take good care, diabetics who take good care of themselves, they live longer than people who are non-diabetic. That means, because if you are a sugar patient and if you're taking good care of yourself, you will, when you go to the parties, when you go to eat, you will take utmost care, you will exercise. And people who are non-diabetic, they might not take as much care, because they will think, I don't have diabetes, so I can eat as much sweets as I want, as much, and they will not take care of themselves. So it was found diabetics who take good care, they live longer and much better. So we don't need to worry about the diabetes, but we need to take care, because otherwise 80% of diabetics, they die from heart disease. High blood pressure, when the blood pressure is more than 140/90, it is a risk factor for heart disease. It again damages the blood vessels and increases the progression of heart disease. The only way to know that you have high blood pressure is by way of measuring it, because it's a silent killer. So we need to understand that also, that these risk factors are silent killers, and we need to regularly check up even if you are feeling all right. Obesity, as we are seeing in this thing, sometimes the weight is not high, but there is an abdominal pouch which is coming out, and it is again a risk factor for heart disease. So there are thin people who have this abdominal pouch which is coming out, and this is a visceral fat, and they are obese, have 72% higher risk. So we should try to reduce our weight and keep obesity under control. Alcohol, small amount may be beneficial in some studies, but I would say if you don't take alcohol, don't start taking it after listening that small amount it is beneficial. In Indian scenario, we have found that even small amount may not be beneficial. So even if you are, drink alcohol for social reasons, it should be not more than 30 to 60 ml, 30 ml for females and not more than 60 ml for males. And you cannot multiply for a weekend thing that, once in a day, 60 ml is okay. So on weekend, I will combine, these many drinks and drink on the weekend. So that's not allowed. High cholesterol, again, doesn't have symptoms, but you need to check it. Bad is LDL is bad and HDL is good. So LDL should be low and HDL should be high. Stress, I think we all know whenever we have stress, the BP rises, the sugar increases in the body, and there are damage to the arteries, which can again lead to increased chances of blockages. So we can discuss about how to manage stress. There are multiple ways, and we sometimes take stress management lectures, even for, just 1 hour can go in how to manage the stress. But meditation, yoga, pranayam, deep breathing, all these positive studies, reading positive things can increase your positivity and decrease the stress level. And when these risk factors, they are together, they have a multiplicative effect. So if somebody has got diabetes, blood pressure, high cholesterol, and he's smoking, this risk is multiplicative. So should I lose hope for having many risk factors? No, because if you control, you will really do well, and there won't be anything to be worried of, because all these risk factors, when under control, they do not affect us significantly. The only most important point is, are we under control? And we cannot rely on our symptoms, because there may not be any symptoms. We have to look at the values, whether the sugar is under control, cholesterol is under control, blood pressure is under control. So this was an inter-heart study which was done, and this was it was found that if you take care of most of the risk factor, you can reduce the heart attack chances by more than 80 to 90%. So these awareness sessions are important. Get the right information about the risk factors. It is only by checking it. Then understand how to modify. There are natural ways as well as medications are available. And we have certain general tips. I think these are the 9 steps to prevent the blockages. Quit smoking, control diabetes, control blood pressure, maintain healthy weight, exercise regularly. Even if you have knee problems, there are hand exercises which are available. You can ask the physiotherapist to prescribe you exercises which you can do if your age, at your age, you have developed certain issues like back issues and knee issues. So there are ways to, prescribe tailored exercise for your need based on your present physical condition. Maintain healthy cholesterol levels and avoid stress. I think we should quit smoking. There's no doubt about this thing. Even passive smoking is dangerous. As we discuss, sugar control by regularly checking whether it is under control or not. If you have one, if you don't have, once in a year, it is mandatory to check whether you have sugars or not. Control the blood pressure, keep it under control. For the ideal blood pressure to have it is less than 130 by 80, but in some cases 140/90, and in very old person 150/90 is also acceptable. Maintain healthy fat by limiting the fat intake. Do not overeat. Have smaller portions of food. Be physically active, and whenever possible, use stairs for climbing. Okay, so that increases those are called as non-exercise activities. Exercise is important. There are 3 kinds of exercise which is important, and in which the cardiovascular has to be there, where you walk for 30 minutes every day, at least 5 days a week. You should do stretching, like movement of your joints, twists and turns of the bodies, like as we do it in yoga. Those are important things. And we should also learn the resistance training. That means using some weights, because as we age, our muscle mass starts decreasing, and it is very important that we maintain our muscle mass. It's very important for our overall health, and you can take help of a physiotherapist to give you resistance training to have a healthy heart. Consume a lot of fruits and veggies, because the wide varieties of colors which we have in fruits and veggies, they give a lot of vitamins and minerals naturally. You don't may need not supplement if you're taking varieties, and they have a lot of antioxidants. So eat varieties of colored vegetables, eat a variety of grain products. You can have non-veg and all, but dairy products, non-veg, they should be in little lesser quantities, while veggies, and they are very important for us. As I told you, we cannot go overboard on alcohol. If you enjoy alcohol, it should be very minimal, and that too once in a while. Cholesterol, it has to be checked. Again, it doesn't have symptom, but high cholesterol can increase the chances of blockages. And if you want to reverse the blockages, you have to keep the cholesterol under significant control. You can avoid very high fat foods. Ghee in small amount is fine. Cheese, malai, fatty meat, all those things you have to reduce a little bit. Oils you can rotate. There is some controversy about the things, but vanaspati ghee, which is dalda and all, you should not use in your diet because it contains trans fats which are really dangerous. Anything, whatever oil you use, if you deep fry, again it gets converted into a very ugly fat which is called as trans fats. How do you avoid stress? Follow your hobbies, interests, take holidays, try various meditation technique, all these things, reading good books, being in good company, all those things can avoid stress and which can reduce the chances of heart attack. So I think understanding the warning signs of CAD and respond in time is very important. Preventing CAD means blockages, coronary artery disease, by adopting the healthy life and staying fit. Prevention is always better than cure. Don't neglect your symptoms. If you feel that something is uneasy, cold sweat, as we discussed all those things, just go and get evaluated by a doctor. And especially those who are diabetics, they may have very unusual symptoms. Silent heart attack is very common. But I thought, silent heart attack is important, but actually it is never silent. It is some symptoms which are there, which we neglect, which are unusual, but because of our either strong willpower, we say maybe it is something, we don't need to go to a doctor. Why should we go? And we try to neglect it. But this is how it happens. And there are certain conditions which can mimic heart attacks, like valve problems, like severe aortic stenosis, and cardiomyopathy, which is the disease of the heart muscles, where also the heart becomes weak. It gets diagnosis. It gets diagnosed on a routine checkup, or the person is feeling breathless. So these are various issues which we should understand. Everything is treatable either through medication and sometimes advanced techniques. Like, for example, these days the valve can be replaced even without open heart surgery. You go through the leg, you put the new valve, and you can get discharged in next 24 to 48 hours. Similarly, if there are critical blockages, angioplasty can be done. Previously, where angioplasty was also not possible, you can get the angioplasty done. The flow can improve, you can improve. Then there are other newer advanced techniques like ECP, ESMR. These are non-invasive, natural ways of treating the blockages. Even severe blockages can be treated. So you should be aware about all these problems. So the take-home message is, if you have any abnormal symptoms, which you find that is something unusual, go and get yourself checked. Take an ECG, which is bare minimum. If needed, the doctor would advise the echocardiography. If anything is diagnosed, there are variety of treatment. There is very good medical management also available, which can actually relieve you of the impact of the blockages, even without angioplasty or bypass, or even the other therapies. Even with medications, a lot of treatment can happen. So I think I will conclude here so that we have more questions to discuss. And thank you very much for patient listening. And I'm happy to answer.
Thank you very much, Doctor. Thank you very much for this very detailed presentation. And we also did not have any problem with connectivity. Doctor, we have a question which has come in.
Okay.
This is from an anonymous attendee. After what age would you recommend a stress test?
Okay. So, stress test is to know how much the heart can take the stress. And it is one of there are total 5 kinds of tests to diagnose blockages. Stress test is the most basic test where we try to diagnose. So what we do is we put the heart under stress by walking, and we see what is the impact of walking and stress to the heart on the ECG. And if there are changes, we would suspect that there are severe blockages. So stress test, there is no ideal age. If there is any doubt about the test, this is the first test which we do. We sometimes do it even 30 years of age, looking at the kind of age group where we are getting heart disease. But usually I would say after 40, because that is the time where the heart disease has become very common. So after 40 years of age, once in a year or once in 2 years, based on your other risk parameters, you can get your TMT done to see whether anything is developing. A good natural stress test is if you are able to climb stairs, if you are able to brisk walk and you're not getting symptom, mostly you don't have any kind of heart disease. But what happens, what I want to give the message is that people don't exercise. And therefore, when you are not exercising or not brisk walking, you will not know that there is a heart disease, because brisk walking is a natural stress test, which will tell you. Suppose you are you are walking 5 kilometers every day and you are quite comfortable. Now you are getting discomfort at even 1 kilometers or 2 kilometers. That means there's something wrong. So that is the first warning signals which you can get.
Right. Thank you, doctor. We have a question from Mr. K. Durga Prasad Rao. He is 71 and he's from Hyderabad. He had a stent fixed in 2022, in December 2022. He says, is there any other chance for attack on the other side? Is there any life limit for a stent? And if so, for how long? He further adds, presently I'm asked to go on Depalat tab in the morning and Stor 40 in the evening. Earlier, I was put on Aster 90 for 6 months and now changed. Before you answer this question, doctor, I would just advise all our attendees today that while some of your questions are very specific, we would recommend that any specific query that you have, there's nothing to beat a clinical personal examination by a doctor, by a medical practitioner. And you can, of course, also connect with Dr. Rahul Gupta via teleconsult, which, as you are aware, most doctors and most hospitals facilitate that. As you know, Dr. Rahul Gupta is available at the Apollo hospitals in Navi Mumbai, and Apollo hospitals does facilitate a teleconsult facility. So, Doctor, once again, I will repeat Dr. Durga Prasad's question is, you have the question.
No, I have the question. I have gone through it. So it's a very specific and question. So I would tell you general principle. After a heart attack, and I'll give you some statistics. So after a heart attack, for at least 1 year, 2 blood thinners are very important. And if somebody is not tolerating 2 blood thinner, we can get down on 1 blood thinner, but that has to be purely with consultation of a cardiologist. Cholesterol lowering medication is given first initially in the very high dose, like atorvastatin, stator, which is taking, is sometimes given at 80 milligram. Then based on the profile, we can come down to 40, 20 and 10. But usually it is, the first year is very important, because the maximum chances of recurrence of blockages in the same area where it was removed is in the first year. And the statistics is about 5 to 10% people can have repeat blockages in the same area. But once the first year is gone, the chances of repeat blockages in the same area is very low, provided you are controlling all the risk factors which we discussed. You are not smoking, you are exercising, you are taking care of cholesterol, blood pressure, sugar, then the chances of repeat blockages are very low. Similarly, the medications which we are giving for the blockages and the stent which was put in the first place in one of the arteries, say left side, the right side is already protected because of the same blockages. And if you are maintain a good lifestyle, even if there are severe blockages on the right side, you can lead a healthy lifestyle with the combination of and without a heart attack, with the combination of the blood thinners and the blood thinners and the other medication and the lifestyle changes. So this is a general principle, but every patient will vary. But these are little general principles. So based on your weakness in the heart is weak or not, what is your cholesterol level, all those doses might increase, decrease.
Thank you, doctor. We have a question from Shalmara Ravi, who says, can a block be reversed without surgery with medicines alone?
Yes. So there are certain studies also, and there are no medication, to be very, very precise, there are no medications which you say if you take it and the blockages are going to go out. And there is no therapy in the entire world which can, if there is a 90% blockage, it will become 0. But there are ways to tame down the blockages, reduce their impact, reduce the chances of heart attack significantly by taking adequately dosed medication, so that the heart attack doesn't occur, the block do not progress. And if adequately controlled with the combination of the lifestyle, which includes all those things which we discussed, plus medication, there can be some reversal in the blockages, which have been studied through medical devices, the cameras which can take photos inside and can find out whether the blockages are reduced or not. Second part is, then there are certain therapies called as ECP and all, which can help you to increase the unused arteries in the heart. So there are unused arteries which are called as collaterals, and there are many blockages. I have treated hundreds and hundreds of patients with severe blockages who were advised angioplasty and bypass through natural means, through natural therapies, with the combination of medicine, lifestyle, and certain, provided they are in a stable phase. That means they are not actively symptomatic or very symptomatic even with minimal exertion. Because if they are actively symptomatic, the only way to treat them is through either angioplasty or bypass. Otherwise, they can land up into a heart attack. But if they are stable, all these measures which I have told you can either reverse the blockages a little bit. In some people, we can see dramatic results, but most of the time there is some reversal which can happen with these blockages. And if the blockages, they become stable, they don't cause heart attack. So that is what we want. People can live with severe blockages for 100 years and 125 years. But it is the heart attack which causes the, the chances of death and major complications. So therefore, the medications and lifestyle is something which can control. But if patient is unstable symptoms, you have to go for angioplasty or bypass.
Thank you. We have a question from Mr. Shrikant Kulkarni, who's 71. His question is aortic regurgitation one of the factors leading to a silent heart attack?
So I was telling you about the valve disease, which can cause, which can mimic a heart attack. So aortic regurgitation doesn't cause heart attack, but aortic regurgitation or aortic stenosis or any other valve problem can cause weakness in the heart, which can mimic like a heart attack, that it's a silent heart attack. But it is not actually because of the blockages, it's the leakage, and the heart has to manage a lot of leakage and all. And because it is overworking to counteract the effect of leakages, it becomes weak in the term. So that's how the heart becomes weak, and it can mimic like a heart attack. You can get symptoms like an anginal symptoms, which is more in the night, which is called as nocturnal angina, and severe aortic regurgitation. So the treatment of severe regurgitation is, if it's a severe aortic regurgitation, open heart surgery is the best way to treat it. Otherwise, if the open heart surgery is not possible or it is very high risky for such patient, sometimes we treat it through the transcatheter aortic valve implantation, which is even without making the patient unconscious. You can replace the valve through the groin arteries, and the patient can become well. So there are ways to treat it, but as I told you in the last slide, it can mimic a heart attack.
Thank you. We have a question from Mr. Vijay Kumar, who's 78 from Mumbai. He's had angioplasty twice in 2012 and 2016. In 2016, it was corrected by a stent in the artery. What is the expiry time for a stent in the case? And his lipid profile is maintained right by medicines. His HDL is about 42. Can it be increased? His ejection fraction is 35.
Yeah, so I will answer in general again. If first, the last one was ejection fraction. So ejection fraction means the functioning of the heart. So normal ejection fraction is around 55, 60, 65, 55 to 70% is the normal ejection fraction. 35% is weak. If the heart muscles after an heart attack have become dead, a part of heart muscles have become dead, then the ejection fraction can never improve. But if the heart muscles are live and they are just hibernating, that means they are getting less blood supply, they are hibernating. Then if you improve the blood supply to that area, then they can improve. Second is, if the heart has become weak without blockages, then there are medications to increase the functioning of the heart, provided the heart muscles are live. And third is, there is a device which is called as CRT, cardiac resynchronization therapy, which can improve the heart function in a selected group of patients. It's not for you, but I'm saying in general, I'm telling how the heart ejection fraction improves. So improving the blood flow through medications and through this device, provided the heart muscles are live. Because if they are dead, it's like watering a dead plant. If you water a dead plant, it can't grow, it can't become good. But if it is becoming stale and it is getting little weaker, you start watering the plant, the flower again blooms. Second is, you asked about the longevity of a stent. Stent can work for life. 5 to 10% people have repeat blockages in the stent. 90 to 95% it can work for their life. But you have to also follow good healthy lifestyle. It's like you repaired the puncture of your tire of your car, but again you are driving on a very stony road with a lot of nails and all, and you are driving rashly, then the chances of repeat puncture is also high. That puncture may not become damaged, but there can be a new puncture. So this is how the simile of I can give it to you. So you can be well assured, if the procedure has been done well, all standard techniques have been used, 90 to 95% chances are there that they run for life. And I think these are the two things. Or
these are the questions. We have a question from Mr. Apurva Mehta, who's 80. He says, can an 80-year-old, well, he's not mentioned his age, but he says, can an 80-year-old patient undergo stress test if he's a mild coronary heart disease patient who on medications is able to brisk walk for 50 minutes without any breathlessness. So can an 80-year-old take a stress
Yes.
test?
So I will tell you, one is called as calendar age. Okay. You are born 80 years back. That is your calendar age. And then one is your biological age. So I have seen 90 years, very fit and fine. I had done an angioplasty of a 95-year-old farmer. Now he was still going into his farms. And when I looked at him, I said, "Are you really 95?" He said, "Sir, I am 95. Believe me." But he's looking like a 70. So I usually, when you get older, we are not aggressive. We want to treat you with medications, as low medications as possible, as less invasive procedures as possible. But if there is a discomforting thing, and so coming to your question, if you are fit enough to walk so briskly, you can also do a treadmill test. There are certain protocols in treadmill test which can reduce the intensity of the stress test. So there is a Bruce protocol, which is intensive. There is modified Bruce. There is Norton protocol. So even at 80, 85, we can do with stress test with a very slow pace kind of. So we make modification based on your physical capacity, your biological age. So I would say that's how we decide. So based on what you are saying that you can brisk walk, I think it is possible to do a stress test if it is needed.
Doctor, there's a question from an anonymous attendee who asks, since you mentioned about the stress test and problems with the stress test, is it all right for somebody to go on a treadmill without having gone through a stress test?
So I would say, see, majority of the time now, you are saying stress treadmill as an exercise.
That's right. At the gym, I think.
In a gym. So you should always, if you are new to a gym, don't get like for example, when we discuss, sometimes I give seminars and all, and people are motivated to exercise. I tell them, slow down. When you're starting your gym, go slow and steady. Don't look at the other gym members who are, running on a treadmill, picking up 100 kgs weight. Not like that. You decide your own pace and speed. There is no hurry. You don't have to go for modeling, or you are not a professional athlete or a person. So go slow and steady. Understand your body. Your body will always give you signals. Even in silent heart attack, there are signals, but we ignore those signals. So if you find that something is unusual, you have to stop down, you have to slow down, and you build up over a period of time. Always remember, when you are exercising, there is a build-up phase, which is called as warm-up phase. Then there is a plateau phase where you maintain the exercise. And then there is a cool-down phase. If you manage these three phases, the chances of anything happening major during the exercise in a gym is extremely low. When we see young people dying during heart attack, they are the people who have gone, they have not done a proper warm-up, they have gone for very high-intensity exercise, and suddenly they have stopped. Stop means they suddenly, just without using a cool-down protocol, they have done. That is the chance when they can get heart attack if there are already blockages in the heart.
Thank you. We have a question from Mr. Trilokia Dubey, who says, I'm 70, gone with the angioplasty. I have liver fibrosis. Is Atherosclerosis bad for liver? And his question is, he always has a high uric acid. What is the effect on the heart?
So uric acid in general, if it is on the higher side, it can cause joint pains. It also can cause kidney-related stones, kidney issues and all. So that has to be treated. And when somebody's uric acid is high, the body's metabolism and metabolic profile is not good. So we need to look at why the uric acid is high, and then we need to treat it through diet medications, and also diet and medications will usually control it. And based on the uric acid level, we have to decrease it. So controlling uric acid from heart point of view, and more so from other joints and kidney stone point of view, is very important.
Right. And is Atherosclerosis bad for liver?
So every medication has the potential to cause the side effect. Now, atorvastatin can cause liver-related side effects, but it is extremely rare. Extremely rare. Smaller doses, almost never. But in higher doses, we monitor the liver profile every 3 months or once in a year. First, I do it at 6 weeks after a heart attack. I have started a full dose of statin, atorvastatin. Then I monitor the liver function, SGOT, SGPT after 6 weeks. Then maybe after 3-6 months. And we know now this patient tolerates it, so we are not worried. And anyways, after 1 year, we reduce the doses of statin based on the lipid profile report. So there is a possibility, but it is very rare. We have to always, whenever we institute a treatment, we have to look at the risk-benefit ratio. Any treatment which is highly beneficial and the risks are low, although the risk may be there, it is worthwhile taking that risk. I can compare it with like driving a car. Now, driving a car is such an essential, or using a transport is such an essential part of our lives, that without which you will be confined to your home. But there is a risk of road traffic accident. But the benefits are so immense that we take that little risk of road traffic accident while driving or while using any kind of transport. So this is called as risk benefit ratio. So for every scenario, we calculate a risk benefit ratio before giving any medications or any treatment. If the benefits are high, we accept the risk with, of course, adequate monitoring to see whether you don't fall into that category where you are, even though the risk is less, you're still developing that risk, and then we modify the treatment.
Right. We have a question from Mr. Umesh Kuncharkar, who's 70 and he keeps good health and walks 4 to 5 kilometers every day. No signs he has, but he wants to check his heart condition. What test would you recommend?
So,
and this is for everybody else.
Yeah, it is for everybody. So we should do certain basic tests. Like, as I told you, there are risk factor analysis, and risk factors you can know only by checking them, because they are all silent killers. You should check your blood pressure, which is very important. Then you should check your lipid profile, because that's how you will come to know whether you have cholesterol or not. Second is you should check your fasting blood sugar. These are very basic tests. If you want to go into little advanced, you can write it down. There is something called as HSCRP, highly sensitive C-reactive protein. So HSCRP. Then there's something called as lipoprotein small a. And these are little more advanced tests which you can do to find out whether you have any additional risk factors for heart disease. And vitamin D, vitamin B12, they are indirectly related to heart health also. They are related to overall bone health and muscular health, but they are also related to the nerve health, heart health also. So you can check them. These are basic blood tests. And then if you want to know what is...
How often would you recommend these? How often would you recommend these, periodicity?
So once in a year is usually sufficient. Once in a year is because if you are otherwise healthy, you never know what is happening in your body. So unless you check them, you don't know. Like, for example, I have my lab inside my clinic, so I check it once in 6 months. But I think the international recommendation is once in a year. Once you are 40 plus, you should definitely check once in a year that you are developing any of these. You can study the trend. They are very cheap tests. They are not very costly at all. And you can keep a track of what is happening.
Doctor, there is a question from Mr. Vijay Hebal. If there's a tightening on the sides of the neck, is it an indication of anything?
So as I told you, anything from nose to your navel, the symptoms of heart disease can occur. So choking in the throat, pain in the jaw could be reflective of heart disease or blockage in the heart. Only thing is, they will reflect a heart problem if it is coming on exertion, because during exertion, the heartbeat increases, heart need more blood. If there are blockages, it reduces the blood supply, and it can manifest like in these areas. So if you are getting exertional symptoms which were not there, especially choking in the throat, jaw in the pain, which gets better with rest, you should consult a cardiologist.
Doctor, I know you are at the operation theater and you will need to get back to work. There are quite a few questions that are coming in, but we will perhaps call you in once again or address these to other people. I'm sorry, I know there are quite a few questions. Shrikant Kulkarni, there's an anonymous attendee, Katie Dadanchi, Karun Bhaya asks, is LDL 130 alarming? Manoj Shah, Marjorie Fernandez, sorry, Marjorie, you sent a very detailed question, but I'm not able to address it. Thank you, Doctor, very much for taking time out today. I know you have just exited a surgery and you are still in the operation theater at the Apollo Hospitals. Thank you very much for being here and for a detailed presentation and and for answering quite a few questions that we have raised over here. As you know, Seniors Today as a platform is addressing the needs of seniors, senior citizens, most of them above the age of 60. And as you can see, Doctor, there are quite a few people who are above the age of 70, 80, who are participating in this and are hungry for authentic information. So thank you to you and to Apollo Hospitals for facilitating this. To all of you over here, there's a small announcement that Seniors Today, we are privileged to announce that we have embraced the Evergreen Club app. Okay, so if you are on an Android phone or an Apple phone, please download the Evergreen app. And this is going to, there is, apart from the health webinar. You will be connected to various programs that are there, and there'll be short courses that we are going to start. So a host of things on the Evergreen Seniors Today Evergreen app, which you can be part of. And of course, the magazine. We've just celebrated our 4th anniversary, and it's there on the SeniorsToday.in website. As you know, Seniors Today is a platform that is available free of cost. We don't charge anything, and there are no conditions apply over there. So you can just come and sample our content. We are available. We have a newsletter which comes out every day, every morning at 6:30 in the morning. You'll get the newsletter Monday through Saturday, and there are a host of articles. It's a good lifestyle platform which you will enjoy. As you know, our last issue of the Seniors Today magazine has some very well-known writers who have written there, and there's Bachi Kakaria, there's Uri Piramal, there are a host of others. So it's a magazine for Seniors Today, but it's as good as any other mainstream publication. So thank you very much, and thank you once again, Dr. Rahul Gupta, for being here. And to all of you here, we will be back once again next Saturday at 5 p.m. our regular time for the Health Live at Seniors Today session. Thank you very much.
Okay, thank you very much. Thank you.
Thank you.
Bye.
Subscribe now and press the bell icon. Never miss an update.